Navigating the Lexicon of Health. Understanding disease and treatment terms. Hello, dear learners. Today, we're going to dive deep into a very important subject-specific vocabulary area. We'll explore the fascinating world of health and medicine, specifically focusing on disease and treatment terms. This knowledge will be incredibly useful not only in academic and professional environments, but also in everyday life. Let's jump right into it. We'll start by familiarizing ourselves with common terms related to diseases. Influenza. This is the formal term for what is commonly known as the flu. Diabetes. A chronic disease that occurs when the body can't regulate the amount of sugar in the blood. Asthma. A respiratory condition marked by spasms in the bronchi of the lungs, causing difficulty in breathing. Arthritis. A disease causing painful inflammation and stiffness of the joints. Remember, it's not just about knowing these terms but also understanding how they're used in sentences. After diseases, let's learn about terms that describe the symptoms and signs of these diseases. Fever. An abnormally high body temperature, usually accompanied by shivering, headache, and in severe instances, delirium. Fatigue. Extreme tiredness resulting from mental or physical exertion or illness. Nausea. A feeling of sickness with an inclination to vomit. Rash. A noticeable change in the texture or color of the skin, often resulting from an illness or allergic reaction. In context, you might say, "He's feeling fatigued with a high fever." It could be influenza. Now that we've covered diseases and symptoms, let's move on to some common terms used in treatments. Antibiotics. Medicines that help stop infections caused by bacteria. Chemotherapy. A type of cancer treatment that uses one or more anti-cancer drugs. Immunization. The process whereby a person is made immune or resistant to an infectious disease, typically by the administration of a vaccine. Rehabilitation. The action of restoring someone to health or normal life through training and therapy after addiction, illness, or imprisonment. For instance, after his surgery, he will need several weeks of rehabilitation. Well, there you have it. We've just scratched the surface of the vast domain of health and medicine vocabulary today, specifically under disease and treatment terms. With these new terms and their understanding, you're better equipped to comprehend and engage in academic or professional discussions revolving around health issues. Keep practicing, and remember, expanding your vocabulary is a continuous journey. Until next time, keep learning and stay healthy.